With your indulgence, Honorable Speaker, may I please request you to just start from the committee observations and recommendations.
You may proceed, Honorable Days.
Thank you very much, Honorable Speaker. The Portfolio Committee made 6 observations from 5.1 that the budgetary constraints of the department that hampers its obligation to deliver healthcare services, the shortage of critical clinical and non-clinical health professionals in the province, the non-appointed youth in the healthcare sector, non-adherence to the 30-day payment of Treasury regulations, the high backlog on surgical operations, shortages of ambulances, especially in our rural areas. The committee therefore recommends that the department must finalize its financial recovery plan with the view to improve and stabilize its current financial position. The department also recommends that the department monitor the implementation of its organogram to accelerate the appointment of critical clinical and non-clinical vacant funded positions. That the department must strengthen its effort to employ more youth, especially in the healthcare sector, to address the high number of youth unemployment. The committee also recommends that the department fast-track the implementation of its electronic monitoring system to properly track and monitor the payment of invoices in order for the payments to be made on time. Also, that the department must accelerate its plans to operationalize theatres at district hospitals to assist with surgical backlogs. Lastly, Honourable Speaker, that the department must approach provincial treasury to increase the budget of emergency medical services in rural areas. Honourable Speaker, this reports to the committee that the departments must forward the following reports to committee within 30 days after the tabling of this report. That a report on the current medical waste contract, a report consisting of a list of members of hospital boards and clinic committees and its functions, a report on progress on the electronic filing system, a report on the state of readiness of healthcare facilities to implement the national health insurance, an update, Honourable Speaker, an updated report on surgical backlogs in the province. Honourable Speaker, the committee acknowledged the presentation from the MEC and the Department of Health. Honourable Speaker, in conclusion, the Portfolio Committee on Health hereby tables this report to the House for consideration and adoption.
Thank you very much, Honourable Days. Honourable members, the committee report is before the House. Are there any objections to the report? Going once, going twice, going thrice. There's no objections, so the House then agrees on the report. And therefore, we will allow then for the declaration of vote from the different political parties. We will start with the Freedom Front Plus. Honourable Chair.
Honourable Speaker, the Freedom Front Plus supports this report. Thank you.
Thank you, Honourable Chair. The PA? There's no member of the PA in the House. We will proceed with the EFF.
No, thank you very much, Honourable Speaker. I think this is one of the most committee where the engagement are very emotional. So this report is a true reflection of what we have raised in committees. I support.
Thank you very much, Honourable Claule. The DA.
Thank you, Honourable Speaker. The DA supports the report.
Thank you very much, Honourable Jooste. The African National Congress.
Thank you, Honourable Speaker. The African National Congress supports this report. Thank you.
Thank you very much, Honourable Chair of Chairs. Honourable Jaffer, in your absence, we proceeded with the declaration of vote. That's when you are leaving the chamber, whilst we are still in business.
Sorry, Honourable Speaker, I was in the toilet. But I can declare.
Honorable Jaffer, I didn't request that the...
Everyone visits the toilet. I don't know why they're laughing.
No. Honorable Jaffer, order, please. If you want to respond, in terms of our rules, you must raise your hand. Honorable Jaffer, please. No. You don't have to respond. I just brought it under your attention that in your absence we have proceeded with the declaration of vote. Thank you. Honorable members, we will then proceed with our business. And let me also thank all the members for their declaration of vote for the committee report as has been tabled. Secretary, can you read us our next order, please?
Thank you, Honorable Speaker. The next order of the day is debate, Budget Vote 10, Health, 2025-2026. I thank you, Honorable Speaker.
Honorable Motlaping. Honorable Motlaping. Honorable Lekwene, can you go back to your seat? I didn't announce that you must come to the podium. My apology, Honorable Lekwene. I know that you are back in terms of your time with SABC, but here we are having our time here. Let me allow you now to take the podium and present the budget of Vote 10, Department of Health, to this House. Thank you, Honorable Lekwene.
Thank you very much, Honorable Speaker. You are the last person I can pick up a fight with. Honorable Speaker, Honorable Nurin Tlaste, Deputy Speaker, Honorable Sharifa Ferris, Honorable Premier Dr. Zamani Sol, the Chief Whip of the Majority Party, Honorable Dr. Norman Khotatamang Shushu, Leader of the Opposition, Honorable Harold McGlua, who seated right in front of me, Chairperson of the Portfolio Committee on Health in absentia, Honorable Lebogang Motlaping, members of the Executive Council, members of the Provincial Legislature, our Royal Highness, I'm not sure he's still here, Khosi Totole Khosi Bareki, our distinguished guests in the gallery, media houses present, and the online community. Let me take this opportunity to present to you the 2025-26 Northern Cape Department of Health budget vote, and to outline our achievements for the past financial year, as well as plans that we are having in shaping up the healthcare system in the province. Honorable Speaker, I'm proud to present the Northern Cape Department of Health budget vote 10 for the year 2025-26 financial year to this important House. The total departmental budget for the current financial year is 6,869,000,000 rand, shortly 6.8 billion rands. As I present this budget to this important House today, I am mindful of the journey that it has taken for us to finally have the 2025-26 appropriate bill passed by Parliament last week. The bill has seen National Treasury allocating additional 6.7 billion rands towards the healthcare sector as a mechanism to try and cushion the health sector, which is overburdened by the challenges regarding staffing, infrastructure, and aging mental equipment, amongst others. The additional allocation will be allocated in line with the provincial equitable share formula as prescribed by the National Treasury, and the budget will be available to provinces during the budget adjustment period. The indicative allocation for the Northern Cape Department of Health is 161 million for 25-26 financial year. The additional allocation will be focusing on the following areas as agreed and adopted by the National Health Council, the NEC: employment of doctors, nurses, and other health professionals, procurement of beds, mattresses and linen, and payments of accruals. Honorable Speaker, shifting global geopolitical dynamics are particularly relevant given the recent policy shifts under the Trump administration, which have direct implications for South Africa's healthcare sector and broader economic stability. The announced cuts to foreign aid programs have already begun affecting health initiatives across the African continent, with South Africa potentially losing critical funding for HIV and AIDS programs, tuberculosis interventions, and mental health projects that have been supported by PEPFAR and other US-backed health initiatives. Madam Speaker, healthcare planning cannot occur in isolation from global political and economic realities that directly affect resources availability and implementation capacity. It is imperative to acknowledge that our public health system serves 87% of the province's uninsured population, creating unprecedented demand pressures on our healthcare infrastructure. This substantial burden underscores our critical dependence on strategic partnerships to maintain healthcare delivery resilience and ensure adequate resource mobilization and implementation capacity. It is for this reason that we need to have a combined model of leverage that includes the role of private sector, both in the cooperative space and private healthcare, as we strive towards building a financially sustainable healthcare system. It is for this reason that we have partnered with the private sector on key initiatives such as delivery of assistive devices such as wheelchairs, hearing aids, working aids, amongst others, to delivery of healthcare infrastructure and surgical interventions that is aimed at addressing the backlogs. Madam Speaker, sitting in our gallery today is a young lady called Susan Polo. There's a young lady, Madam Speaker. Thank you very much, Susan. You can sit down, girl. Who is one of our patients who received medical treatment at Robert Mangazu Sobukwe Hospital. Susan is one of the 2 patients to receive a pioneering bone bridge implant. It's a hearing device surgery at RMSH. This was the first of its kind in the province, and it just demonstrates the capacity of our joint partnership with our private sector and the capability of our healthcare system, despite all challenges we are faced as a province. Despite all challenges we are faced with as a province, in 2024-25 financial year, we performed a total number of 6,926 surgeries in the province against the total backlog of 7,906. It's a pity Dr. Fritz is not here. He's been asking this question for the whole 5 years. Oh, he's there. I want to repeat this point, Honorable Speaker. In the 2024-25 financial year, we performed a total number of 6,926 surgeries in the province against the total backlog of 7,906. This translates into 88% success rate. Through this is a moving target. We will be placing additional resources this year that will include, amongst others, the resuscitation of our outreach program to perform surgical marathons at some of our district hospitals and regional hospitals, with much emphasis on orthopedic cases as well as urology. The huge backlog is on orthopedic cases as well as urology. Recruitment and retention of medical specialists and theater-trained nurses remains a critical challenge for the department despite all attempts to fill these vacancies. I must repeat this one as well. Recruitment and retention of medical specialists and theater-trained nurses remains a critical challenge for the department despite all attempts to fill these vacancies. It is against this backdrop that we are now looking at options of partnering with private healthcare providers. Additionally, we have intensified our registrar program as a mechanism to allow opportunity to those medical practitioners that would like to specialize with an intention to retain them post the completion of their studies. Honorable Speaker, as part of decanting overburdened facilities to reduce the volume of patients visiting our healthcare facilities, we recently introduced a smart locker technology in the John Taulo Gaetsewe and ZFM Gao district. These innovative lockers allow patients to collect their medication quickly, conveniently, and privately, without long queues or waiting times. Using a simple security code sent to their mobile phones, patients can access their prepackaged medication at a time that is convenient to them. Madam Speaker, this is healthcare innovation that is responsive and patient-centric, as it promotes respect, human dignity, privacy, and time spent at our healthcare facilities. We will expand the deployment of this technology on an incremental basis. Madam Speaker, the Honorable Premier Dr. Zamani Sol, in his State of the Province address earlier this year, shared with us the plans that we have as a province that included infrastructure investment. Allow me to give progress thereof. The following healthcare facilities were completed during the 2024-25 financial year: Yeneflay Clinic, Boegubert Clinic, Bankara Budulon Clinic. Additionally, it should be noted that the following facilities are undergoing a process of revitalization and will be completed by the end of the current financial year. That is Rikwastad Community Health Center, Kemu CC, Lehobate CC, Dr. Athalitele Medical Depot. In the 2024-25 reporting period, the Honorable Premier unveiled plans to build a new Smithsdrift Clinic. I am delighted to announce, Honorable Speaker, to this House that the facility will be completed by the end of this calendar year. By December, we'll be handing over the facility. Additional to this, Vedanta Zinc International recently announced a multi-million investment into an oncology chemotherapy center at Dr. Van Niekerk Hospital in Springbok, as outlined by the Premier in his State of the Province address for 2025-26, representing one of the mining company's largest corporate social investment programs. The construction on the oncology center, spanning 356 square meters, is underway and expected to be completed December this year. Madam Speaker, I have taken note of the recent incident that took place in Kuruman Hospital that may have been perceived to have an impact on human rights. Coincidentally, when the matter emanated, plans were already underway to revitalize the hospital, which started with the walkways, fencing around the hospital, replacements of beds and linen. These plans were soon to be followed by the refurbishment of the accident and emergency unit. Secondly, it is important to note that the condition-based assessment performed by the department in the last reporting period highlighted infrastructural challenges as one of the major factors affecting access to our hospital. It is also worth mentioning that majority of our healthcare facilities were built for limited number of population size and with limited services. What we're experiencing now is the result of us improving and expanding access to healthcare services to serve 87% insured population across our province. Honorable members, it is important to note that this is an area that has experienced a growth in population size due to the economic activities around the mining sector. Kuruman is no exception. The Kuruman town has grown exponentially. It has doubled its population. That's why the pressure on that hospital in town. We are in the process of installing the temporary structure as part of decanting the congestion around accident and emergency, and we have also looked at a long-term solution that will see the accident and emergency, and some words, revitalized in the next 18 months. All these are initiatives and responses of the government in action. There's no by-election there, by the way, but we are working already there. Emergency medical services, EMS, remains one of the most challenging factors in the department. I want to repeat this, honorable members. EMS remains one of the most challenging factors in the department, despite the annual investments made in the net replacement of ambulances and planned patient transport. Annually, we plan for the procurement of 30 ambulances as part of improving our EMS services and response time. We are currently sitting at 91% coverage rate when compared with the national norm, as the province has a total number of 128 ambulances as opposed to the desired number of 140 ambulances. But we are making a confession. We are agreeing with all of you. EMS is a challenge for the province, given the size and the vastness of Northern Cape Province. Despite the challenge, the province response time for both urban and rural is sitting on an average of 65%, which is 5% above the national norm. This achieved despite the vastness of the province and distance between referral facilities. Madam Speaker, in consultation with our provincial counterpart, Treasury, together with the Office of the Premier and the Northern Cape Fleet entity with Public Works, we are exploring a model that will support the function of accelerating the procurement of ambulances in the most cost-effective and efficient manner. The process also seeks to address the maintenance of our fleet management, given the challenges we're experiencing in the current dispensation. The Legislature Portfolio Committee on Health earlier this year released a report they termed pre-oversight visits to health facilities. Quite a good report, by the way, Honourable Speaker. I have the opportunity to read the entire report. Amongst others, the report states, I open quote, the austerity measures implemented last year negatively impacted service delivery and budgets at regional health and social development facilities. Delays in filling and abolishing vacant posts due to the budget constraints have placed enormous strain on existing staff, close quote. We may add that budgetary constraints has been a recurring theme. In spite of this, we continue to provide health services and extend the basket of services. Despite all these challenges, we continue to provide health services and extend the basket of services. As I'm speaking to you now, all our 212 facilities are open in the province. Our PCCs, hospitals, both regional and district, and the tertiary hospital. Babies are being born, patients are being helped, dealing with trauma cases. So we must never be under the illusion that the healthcare service in the province has collapsed, unless we're not properly informed. Madam Speaker, before presenting our budget vote, allow me to address the narrative that dismisses the remarkable health transformation occurring in our province. The Human Development Index, that's HDI, for the Northern Cape has risen substantially from 0.618 in 2005 to 0.705 in 2025. With our department's contribution reflect most powerfully in the dramatic improvement of life expectancy across our communities. Women in our province now live an average of 66 years, compared to 54 years in 2021. Precious additional years spent with families, nurturing communities, and fulfilling dreams. This progress extends beyond longevity to maternal safety, with maternal mortality declining significantly from 115.8 to 90.4 deaths per 100,000 births. Put simply, 25 fewer mothers are lost for every 100,000 babies born, each representing a family kept whole. For men, life expectancy has increased from 50 years in 2021 to nearly 60 years today. Quite a dramatic turnaround. Madam Speaker, these are not mere statistics. They represent grandparents meeting grandchildren, parents witnessing graduation, and communities retaining their wisdom and institutional memory. This evidence unequivocally demonstrates that healthcare in our province is on an upward trajectory, not in decline as some would suggest. While we acknowledge the persistent challenges we face, the historical burden of disease, systemic healthcare inequities, and current fiscal constraints, these obstacles have not deterred our commitment to preserving and extending life. Madam Speaker, there is a new era for our department. We embrace accountability as a non-negotiable and commit to ensuring that public resources are protected through transparent governance and decisive action against financial misconduct. This clearly demonstrated that by our ability not to incur any unauthorized expenditure in the last 3 reporting periods. In the last 3 years, health did not have unauthorized expenditure. Honourable Speaker, our medico-legal case management demonstrates both encouraging progress and ongoing financial challenges that require urgent attention. On the positive side, we have achieved significant gains through effective case settlement strategies. Over the past 3 years, We successfully settled 18 cases, saving the department 184.9 million by negotiating settlements of 122 million against original claims totaling 306.9 million, representing a 60% cost reduction through strong legal defense. Additionally, our overall medical legal liability has decreased from 1.564 billion in 22-23 to 1.361 billion in 24-25, reflecting a 203 million reduction in our exposure. However, Madam Speaker, the remaining 1.36 billion liability continues to pose a substantial burden on our financial health, representing approximately 20% of our entire departmental budget. This unfunded obligation significantly constrains our ability to invest in service delivery improvements that are directed towards patient care. Madam Speaker, the signing into law of the National Health Insurance Bill by His Excellency President Ramaphosa on the 15th of May 2024 will remain a transformative milestone towards universal health coverage. This was a much more needed reform given the imbalance currently experienced in our country in accessing healthcare system. Therefore, a single healthcare system is the future that all of us should jointly support. This historic legislation directly confronts the moral injustice of our current two-tiered healthcare systems, where quality care remains the privilege of the few, while the majority depend on an overburdened public health system. Therefore, it is in this context, Madam Speaker, that we welcome both the national dialogue announced by the President in the State of the Nation Address and all-inclusive provincial national building and social cohesion dialogue announced by Premier Dr. Zamani Sol in the State of the Province Address. In the Northern Cape Province, where geographic isolation compounds healthcare access challenges, the NHI represents hope for our rural communities who have been systematically disadvantaged by distance and economic barriers. This legislation transforms our healthcare systems from a market-driven commodity into a public good that serves all South Africans with dignity and equality. Madam Speaker, beyond policy, we are actively pioneering NHI implementation on the ground. In our last budget vote, we reported on our agreement with the National Department of Health to establish contracting units for primary health care in Polokwane local municipality. Today, I am proud to announce that this pilot is operational and yielding critical insights for national NHI rollout. The Northern Cape forms part of the nationwide testing of this revolutionary healthcare financing model, positioning us as pioneers in South African healthcare transformation. Our Polokwane contracting unit encompasses Hartswater and surrounding areas, integrating the district hospital, primary health care clinics, ward-based outreach teams, and accredited private providers under a single funding and management structure. Honorable Speaker, allow me to take the public into confidence today, unveiling our ideal health facilities realization and maintenance program, a comprehensive intervention designed to transform the physical state and operational standards of our healthcare facilities in alignment with the regulatory framework established by the Office of Health Standards Compliance, OHSC. This program, through the National Department of Health, comes as part of our broader efforts to strengthen healthcare systems. Honorable Speaker, in our 2024-25 budget presentation, I comprehensively addressed the quadruple burden of diseases confronting our healthcare system. This burden encompassing HIV/AIDS, tuberculosis, and non-communicable diseases, and injuries from violence and accidents continues to define our epidemiological landscape, with HIV and AIDS and tuberculosis remaining the primary drivers of mortality in South Africa. Madam Speaker, in our 24-25 budget presentation, we outlined our mitigating strategies to reduce HIV prevalence and morbidity through accelerating testing, initiation, and maintaining patients on treatment. The HIV cascade program known as 95-95-95. On this scale of the cascade, we are now sitting at 94, 79, and 92. The second 95 is quite challenging. We'll have to do more on it. Across these critical targets, Our focus is now to trace the 15% of the HIV positive patients that we have tested and are known to be HIV positive, but not on ARVs. The challenge is that there are many patients who know their status, but they are not on ARVs. We'll have to get them on this ARV so that they must live for long. This initiative is part of the 1.1 million ART Close the Gap campaign that was launched by the National Minister of Health, Dr. Aaron Motsoaledi, earlier this year. Madam Speaker, leadership and governance is one of the fundamental areas that we should focus on to ensure a financially sustainable healthcare system. Last week, I met with the Office of the AG in quest towards our journey of renewing our commitment of receiving an unqualified audit, as mandated by the Honourable Premier. The AG highlighted the culture shift approach that they have observed over the past 2 reporting periods on the improved financial management discipline and reaffirmed that we are on the right track towards the finishing line, which seems to be a long journey for the department. Premier, your leadership and support in advocating for clean administration will soon be rewarded by an unqualified audit for the department in the next maybe 2 years, 3 years, Premier. There's not a child's play. It's a very difficult task. As confirmed by the AG, if we maintain the same consistency. Honourable Speaker, I extend my sincere gratitude to the Premier of the Northern Cape, Dr. Zamani Sol, my colleagues in the Executive Council, and the Portfolio Committee on Health for their unwavering support and strategic leadership. I also acknowledge the acting head of department, Mr. Mkoli Simlata, our executive management team, departmental staff, and the ministry team for their steadfast dedication to achieving our vision of a modern health system delivering quality care to a growing province. This moment calls for unified action to deliver meaningful public value. United in purpose, we will achieve greater impact in our shared pursuit of a better life for all. Honourable Speaker, I hereby table to this August House the health budget vote 10 for financial year 25-26 for consideration, Honourable Speaker, and I want to thank you daily for the opportunity and I rest my case, Honourable Speaker. Thank you very much.
Thank you very much. Thank you very much, Honourable Lekwene, for presenting the budget of Vote 10, Department of Health, to this House. Honourable members, we will give an opportunity for political parties to participate in this debate. We will start with the DA.